Hi, I'm Charlie Peterson.
Hi, I'm Alexandra Guevara.
This is Asking for a Friend.
Should everyone see a pelvic floor physical therapist after giving birth?
So pregnancy and birth, whether it's a vaginal birth or a cesarean birth, put an enormous load on the body, especially the abdomen, the pelvis, and the pelvic floor muscles. For example, it can take over a year for the pelvic floor muscles to regain their strength and shape after a vaginal birth. So you can really compare labor and delivery to like a major sports injury, and we believe that it deserves the same care and attention as a sports injury. So everyone deserves access to pelvic health physical therapy, especially if, as you're healing from birth, you're noticing any issues with urinary control, bowel control, pelvic pain, or having symptoms of like pressure or heaviness, or you're just needing a little extra guidance to get back to sports or any activities that you love. I thought urine leakage was normal when you get older or have a baby. Is that true?
Urine leakage is common after delivery and also can be a common thing that happens as we age, but it's not normal. We are taking a look at what kind of urine leaks might be happening. That could be something related to stress incontinence or leaks with coughing, laughing, or sneezing, which can be a common thing that happens after giving birth. There are also other types of urinary incontinence like urgency, where you're not making it on time to the restroom, and those can happen. But we're here to help in terms of getting those muscles working a little bit more properly, seeing if we need to add any additional exercises or changing habits or lifestyle. Is there any benefit to seeing a pelvic floor therapist before labor?
We're here to help you manage this and stay as active as you can throughout your pregnancy. We can also do things like help teach perineal massage after 35 weeks if that's something you're interested in doing to prepare for birth and you need a little guidance on how to do that. We can also, if you have any pre-existing issues, come up with some ideas of how you might modify your strategies during labor and delivery so that you're in positions that work well for you.
Is the urge to pee even years after giving birth common?
Common, yes. Normal, maybe not so much. So urinary urgency is when you have a very strong urge to pee that you can't delay, and you might even have a hard time getting to the bathroom in time. And it's typically pretty treatable. There's a lot of things that can contribute to urinary urgency. The pelvic floor muscles are definitely one of them, so it's always worthwhile to check in and see if working on your pelvic floor muscles can help with your urinary urgency. But we would also discuss things like your lifestyle, your habits with your bladder, how diet can affect your bladder, and especially your bowel health. And you want to keep your doctor updated too, because things like blood sugar levels, blood pressure can affect your urge to pee. And some of past medical histories, like if you've previously had treatment for cancer or past surgeries around your pelvis, all of those factors combined can affect when we feel our urge to pee and how much control we have over it. So it's great to take a team approach to this so you can get back to living your life normally without feeling like you're having to interrupt it to run to the bathroom all the time.
This is Asking for a Friend. I'm Alexandra Guevara.
I'm Charlie Peterson. It's been awesome to talk through these questions today, but please remember, these are general questions for general answers. They are not a substitute for individualized medical advice from your healthcare provider.